name's Rich Gurney. I'm Wiltshire and Avon Vice Chair of the Unison branch. Our union branch covers people who work in a couple of NHS trusts and also people who were put into an arm's length organisation by 3 NHS trusts in Wiltshire. They soon found they weren't on NHS terms and conditions when they didn't get the COVID payment that other NHS staff got. It meant that our members campaigned, recruited, and in the end took strike action, and suddenly, hey presto, the COVID payment was made to those members. They were rewarded earlier this year by finding out that along with a number of other staff, they were going to be transferred to an organisation called HCRG. HCRG took over Virgin Care. They are owned wholly by 2020, a hedge fund, an American hedge fund, that is viciously against trade unions. And also, it would appear, doesn't really know an awful lot about healthcare. They have become a multi-million-pound provider. We don't think it's good for services at all, not least because if you treat staff badly, the service that is provided isn't going to be as good. So at the minute, our members and our union branch are engaged in fighting for a union recognition battle, but also to campaign to bring the services back into the NHS where they belong. Primary care services and specialist services should be being provided by the NHS, not by an organisation that's key primary motive as a hedge fund has to be to make profits for its shareholders. That's not right. We fought, but often that has been at local level, and that's been the criticism by some of us, that actually there hasn't been a national strategy. A union as big as Unison, which is the public sector union, actually hasn't been punching its weight, many of us feel. So our branch, along with a number of others, have been involved in trying to get, one side is that as they member the National Executive Council, we have nominated people from the Time for Real Change campaign, which is trying to say, let's do something better, let's punch our weight as a trade union. We represent people, we are both particularly in local government, but in health as well. And actually, it's our health service, our National Health Service. We want a union that fights to defend not just our members' terms and conditions, but the service that's provided. And the only way we can do that is by having a strategy, a national strategy, not leaving it to branches to fight individually, as we do at the minute. We will do that, but actually we need a joined-up strategy that says how we're going to oppose these things and see them off completely. If we have to, then we will resort to industrial action, and that's what our members have done. In Wiltshire Health and Care, it did make a difference, actually. The management used to ride roughshod over people. They didn't after the strike action that those members took, but that was one branch doing that. What we're aware is that, these, as you said, the SubCos are popping up here and there, and actually we know it's an expensive mistake. You've only got to look at the local authority side to know that the bins were one of the first services that were privatised. Many of those have been brought back in-house now. Why? Because it's not cheaper to privatise stuff, it's more expensive. But that goes back to who the politicians have got shares with and all the rest of it, I suspect. But we know, as a trade union, if we're an independent trade union, we should be fighting as an independent trade union to say public services are best provided by the public.